So today we're going to talk about complementary feeding, which most of you know it as weaning. I'll explain the difference in the video. And I'm also joined by a baby. What's your name, Mama?
Kinley.
Yeah, Kinley is going to join us today as well. So I hope you guys stay tuned and enjoy the rest of the video. You learn more about complementary feeding, how to introduce it, and how to take care of your baby while young.
Advice, like for me as a new mom, I didn't know when to start complementary feeding. I didn't know the types of food I was supposed to give my baby, the consistency of the food. Was I supposed to continue breastfeeding or not? So as a nutritionist, what would you advise such a parent?
Yeah, that's a very good question. But first, let me clarify. I told my viewers will clarify the difference between complementary feeding and weaning so that at least you have an overview what it means. So then I can answer the rest of the questions that you had. So in complementary feeding and weaning used to be used long time ago to tell people when you introduce foods, you stop breastfeeding, because when you're weaning, you're giving the child food and completely stopping them from breast milk. Then the WHO also strategized, and I think they started introducing now the complementary feeding, So this is now when you're introducing the food and complementing it with breast milk. So you can still continue breastfeeding your child up to 2 years and then introducing the food at 6 months. And this is what is called complementary feeding.
When is someone supposed to start complementary feeding? Is it at the beginning of 6 months or the end of 6 months? There's always a confusion when it comes to that.
Yeah, that is a very good question. So 6 months, we believe that by 6 months, your baby will start showing you signs. And it should be at the beginning of 6 months.
Okay.
6 months, when the baby begins to grow now, the digestive system has already grown, has already formed. The baby can start handling food. And you find the demand of the baby is increasing now, the beginning of 6 months. So that's when you will start introducing complementary feeding to your baby.
Okay.
Yeah.
So what are some of the telltale signs that my baby is ready for complementary feeding?
Well, complementary feeding, the baby sometimes guides you.
Okay.
So let the baby always guide you on what to be eating. So the signs that your baby is ready to eat, one of the signs is the baby can sit upright on their own. So I have a dummy with me. Let me just use this for a minute. The baby will be able to sit down on themselves, like fully sitting properly. After that, you notice like the baby, when they're very small infants, like in the beginning of one, you find that they open their mouth when they're suckling. They use a reflux, they do their tongue like that. That is a way that they're protecting their mouth from anything foreign that can come in. They can only handle the breast milk. Then after 6 months, the reflux also changes. Now the baby starts opening the mouth like, ready to be given food. Okay? So that's another one. Then also the baby will start, whenever you put something in their mouth, or you find the baby start eating toys, anything they want, they put it in their mouth. Anytime you put a spoon also, they want to open up their mouth. So that is another sign the baby is ready to eat. Another sign also is the baby now, anytime you guys are eating, the baby is always like looking at you and crying. They want that food that you're eating. So those are some of the signs that the baby is ready for complementary feeding.
And Angie, I also have a question on consistency. What is the best consistency for food? Are you supposed to blend the food or use a fork? A lot of parents use the fork. Some use the sieve. What would you advise? What is the best consistency for food?
Okay. When you're introducing the baby's food also, you make sure the consistency is not too light. Okay, it shouldn't be so light like water, the way water flows. It should be a moderate consistency, and then it should not be too heavy. So those two, either light or heavy, they can easily choke a baby. Okay, which we'll talk about the choking hazards as well. So the moderation consistency is very good for the baby. It will really give all the nutrients the baby needs, and it will not choke. If again it's too thick, the gut of the baby, the gut is already developing. So you find that the baby can easily choke, or your baby will start gagging all the time when you're feeding them. And most parents panic and think the baby is choking, and maybe it's just gagging. So make sure its texture should be at least smooth. You shouldn't have particles. This is a baby that you're starting to introduce complementary feeding. So in case you don't have, whenever you're mashing, for instance, if you're using a fork and you mash completely, for instance, if it's potato, and make sure your baby's food is also balanced, and you mash and you find that the particles are not going, you can always sieve the baby's food. That is 6 months. You can sieve. You can use your normal siever and sieve until the texture is super light. Don't have any particles when you're introducing a baby complementary food. It should always be light and smooth. Yeah.
Okay, Angie, that brings me to another question. Yeah. There are some of us, me being an example, mixing. What do you talk about? Mixing of like in porridge, for example. There are those of us who mix rice. There is omena. There is millet. There is groundnuts.
I've had that with a lot of parents.
Yeah. What do you think?
This food cook in different temperature. Okay. Yeah. For instance, your omena cooks with different temperature, and these are not things that you can introduce to a baby. Not all cook at the same time. So never mix this type of porridge together. I know traditional parents, they're like, you have to feed your baby with this. You have to feed your baby. You have to mix. They are very good nutrients for the baby, and they'll help the baby grow. That is wrong. When you're introducing one food at a time, don't mix so much cereal in your porridge when giving the baby. It's too heavy for their digestive system, and also the cooking time is different. So make sure you introduce one porridge at a time for the baby.
Okay.
Yeah.
I think that brings me to the other question, which would be, how do you know that my baby is allergic to, say, soybean or rather eggs? How do you be able to tell that?
So, now let me talk of when you're starting complementary feeding for your baby. There are certain foods when you're introducing a baby you should never introduce. They're called allergens. They can easily interact with the baby or react to the baby and cause those allergic reactions. So if, for instance, we talk of the type of food that you can introduce, you can always introduce uji. And some people will find that the baby can get constipated with windy. So depending, you can introduce uji or even maize, the cooking maize for your ugali, that ugali. You can also start introducing that to your baby. You can also mash your oats, very tiny particle, and make oat porridge for your baby. So, or rice porridge for your baby. So those are very good types of porridge that you can introduce to your baby. And also, make sure that whenever you're introducing these foods, you also, maybe day one, as time goes by, you can add other protein because the baby needs to. So you monitor your baby's progress, okay? Some babies can react to certain things that you don't know, and there are certain things that you cannot introduce to a baby. For instance, never start introducing a baby to seafoods or milk, dairy. Kids also react to dairy. It has milk has casein, which is a very hard protein to digest in babies. So never start introducing the baby to cow milk, okay? So never start introducing a baby to wheat. Those are allergens already for a baby. So when you're introducing, then you realize your baby is reacting, you stop immediately. The baby will definitely show you the sign of reaction. Some get rashes. You stop that food. And then after a while, maybe after 1 or 2 or 3 weeks or even a month, you can reintroduce again and see if your baby will react to the same food. That's when you now start establishing boundaries on what you can give your baby and what you shouldn't give your baby. But never start with very, very high allergen foods that like the ones that I've mentioned.
Okay, what are some of the symptoms to look out for in a baby to show you that this baby is maybe allergic to something or whatever?
So that is a good question. Sometimes when a baby is allergic, you find that they always cry all the time. Sometimes a baby can be sick and you don't know. Other kids, you find that they start, when they have allergic reaction, you find that their tummy really hurts. So wanajikunja, like kujikokota, it's so much painful, they cannot hold. Others, diarrhea. Okay, others get, their tongue swells or their mouth around here swells and their face swells. Others also, So those are some of the signs that a baby, or they cry all the time, consistent crying, and you don't know. So that is also some of the signs that you're showing that your baby is allergic to certain foods. And please, whenever your baby is doing this, discontinue that food, and maybe in future you can reintroduce it, but never continue giving the baby when you see these signs that I've mentioned.
Okay.
Yeah.
I have another question. How do you handle food preferences? Like, you find your baby likes a certain type of food more, like when you give, say, Cerelac, for example, the baby tends to prefer that Cerelac. When you give porridge, the baby doesn't want to take that porridge.
Yeah,
How do you handle that?
So I've had that from many mothers as well. So food preference, mothers, please note it. It's very common in kids. And this is you as parents, you make this mistake where you introduce your baby to sugary stuff or fruits, like Cerelac, for instance. They're sweet to the baby. So anytime you start introducing porridge, the baby doesn't like that taste. They're used to a sweet taste in the mouth. So that's why it's important, start with bland foods like the ujis. Don't introduce, and uji is even more healthier than these other processed Cerelacs and the rest. We don't know how they're made. Uji, we already know how it is made. So start with bland foods. Never start with sweet foods and then introduce the other foods. The baby will definitely hate them because they're not sweet like the foods they're used to. So anytime you're starting foods, bland, and then progress gradually as the baby goes on. And also never give your baby sugars. Okay, like the way I see most parents, they put sugar and they stir it in their food. The baby doesn't need that. Okay, these foods, the baby can get the energy, and also that is a taste that the baby doesn't really need. So the sugars, they have, the purpose is just to give energy, which they can get it from the carbohydrates. So never introduce your baby to sugars at an early stage. You can only give salt in the baby's foods.
How much salt?
Just a pinch, like so little, like a pinch. Please don't put like a teaspoon, that is too much. Okay. Like a pinch in the baby's food because of
what
sodium.
Of parents who substitute sugar with honey? You hear a lot of people saying honey is more healthy than sugar.
No. Please, if your parents, please never give honey to babies. Okay? Honey has a bacteria. This bacteria is known as Colostrum botulinum. And this bacteria can really interfere with the baby's nerve system. Okay, so it's not healthy to give a baby honey at early ages. Don't ever don't ever give honey. And some of the symptoms that the baby can react from this honey is they start diarrheaing. Others can even get constipation. So sweet foods, they are not very essential when you're starting to complement the complementary feeding to your kid. So no honey, no sugars. You can only give the foods that I've mentioned in small portions when you start complementary feeding.
Okay.
Yeah.
I have another question.
Yes, please.
What about food preparation? What methods are you supposed to use? Are you supposed to stir fry, deep fry them?
Very good question.
Boiling?
Yes, boiling. Most parents, if you're watching this video, you're a victim of boiling your kids' food. And then after some, when they start growing up and seeing you eating exciting foods, they start wanting that food and they never want their food. Yeah, so parents do that a lot of time. Never boil your kids' food alone. Oils are very essential for digestion. Oil helps in digestion and gut system of the baby, especially when it's developing. So cook this food the way you would cook your own food. No, I don't mean the way you cook with so much spices. Please don't get me wrong. Cook with your onion, tomato, the way you cook your food, and it should be balanced. You can put your potato, you can put your pumpkin. Most people don't know this, but pumpkin is a vegetable, okay? So make sure you can put your pumpkin or butternut, and then you can put your protein. You can even put fish fillets, very lean. You can also put a bit of, if it's meat, don't start immediately with the meat, but if it's meat, it should be the lean part of the meat. Chicken also, legumes. Most parents don't know this, but you can give your baby beans, green gums. They're very healthy. So those are the portions that you can put in your plate. Make sure your baby's plate is balanced. Fry them with small amount of oil. Never deep fry your baby's foods. That is too much oil for the baby to handle. Don't deep fry.
They want chips.
Yeah, how can you start
eating chips?
Yeah, especially when the baby grows. for instance, that is baby is like 1 year and above and sees you eating chips, you can always just give one chip. That does not harm. Okay, that is when the baby can now eat by themselves. One chip, but when you're introducing, never give a baby chips. They are very, very high in fats. Okay, and these fats are not, the baby's system is not fully developed to handle those fats. So never introduce, as much as you're eating the chips, if you have to, just mash a tiny bit to kumdanganya too, but don't add so much or give your baby a full meal that consists of fries. That is so wrong.
Angie, I also have another question. What of those parents who won't manage to breastfeed their babies up to 6 months? Like in my case, I really had challenges breastfeeding, so I had to opt for other methods to make sure that my baby was not missing out on other nutrients. What would you advise such a parent?
So you find that it's advisable parents wait up to 6 months. That is the recommended, the standard one. But sometimes you find the needs of the babies can be more, or the baby wants to start eating. As I said, let the baby guide you. The baby wants to start eating at 5 months. So at times it's good to talk to your pediatrician or your nutritionist. They can assess this baby's growth first and see how they can before introducing. Because there are other risk factors associated with introducing a baby to food very earlier than it's recommended, because the system is not fully. One, the baby can easily get constipated. Okay, because the system is not fully developed. The baby is not able to handle the foods. Okay, some can get diarrhea or constipation. Others can start getting, if you introduce very quickly, some kids start having breathing problems or become obese. Okay, so it's very important to first talk to your nutritionist first. Okay, or for the viewers, you talk to your nutritionist or your pediatrician before you introduce this complementary feeding. If you feel the need, the baby wants the food at an early age, that is one thing that you should always remember. Never start at home like, my baby is hungry, let me just start. That is not how it goes. Talk to your nutritionist or your pediatrician, and then they can advise you for the way forward. So that brings me to something else. When you're also feeding your baby, you should always have the baby sitting on your lap. Or if you don't, those who cannot afford the rocking chairs or the place where the baby can sit, make sure the baby is seated on your lap. Okay, so when the baby is seated, upright. Upright. This baby is at 6 months, they can sit upright on their own. You don't have to put things to support the baby. And make sure the baby engages you. Okay, let the baby guide you on how you need to feed her. I've seen most parents, you take your baby. Here I have my baby, she's called Judy. Judy, say hi. So you find that most parents take their babies and then they put them in this position, and then you feed your baby like this. This is so wrong. The baby can easily choke because this position is a slanting way. Even you by yourself, you cannot eat when you're slanting. So never put your baby like this. Always make sure the baby is seated upright. And this way, also the baby is not engaging. You need to have engagement with the baby where you can see your baby and they can tell you like, oh, when you put a spoon and they're like turning their back aside, this baby shows you, I don't want the food. Don't force it.
Or they're full.
Or they can be full, or maybe you're just starting. Let's talk when you're starting and the baby refuses. Don't. And this happened if you have just finished your breast milk and then you want to give the baby food. The baby is already full. So make sure you don't breastfeed immediately and give your baby food. Give your baby food when she's maybe walking up or something before you give the breast milk, so that the baby is already hungry, ready to eat. Okay? So this position, and never force your baby to eat, opening their mouth again and trying to force food. Most African traditional parents are like, mtoto lazima akule. So they open their mouth completely and try and force him. This can easily choke a baby. Okay? Always let your baby lead you in eating. If they don't want the food, try again another time. If they are comfortable with the breast milk, continue giving the breast milk.
And another thing, this brings me to the point where there are those babies who have challenges, a lot of challenges, like I would use me all the time. My baby had this problem of GERD, the reflux, where the acidity,
it's coming back.
Acidity. What would you advise such a parent? Are there foods that they need to avoid? Are there foods that they need to give the baby? Should they see a nutritionist first or the doctor first? And then what are some of the signs that this baby has GERD or problem with acidity?
Yeah, that's a very good question. And I know most of the viewers are wondering what GERD is. So let's start by understanding what GERD exactly is. So we have something called as acid reflux. I know most people know what acid reflux is. This is the process where after you've eaten in the digestive gut, in the esophagus, where the food passes, before it joins the stomach, there is a muscle. That muscle is what it controls the opening and closing. So after you've eaten and the food is next to the stomach, the muscle opens up to allow the food to go to the stomach. In the stomach, there are other acids, HCl. That is the major acid in the stomach. So this is the one that aids in digestion and everything. And you find that this HCl is purely meant for the stomach. If it comes up, it can easily cause, there are those who suffer from heartburn, stuff like that. The acid comes up, and then that's when you start feeling that way. And it can easily corrode your esophagus because that acid cannot be contained in that place. So when this happens, this is what we call as reflux, where the acid comes back on the esophagus and you feel like a burning sensation there. So different repetitions of that's what we call GERD. Okay, and GERD is gastroesophageal reflux disease. Okay, so most kids can easily get that. Even in adults, they can easily get that because it's a repetition of that acid reflux many times. So before it progresses to GERD, there are those signs that a baby will start feeling, like the way you start when you feed your baby, they kind of like gag,
like in my case, gagging. Like in my case, my baby really used to have very frequent vomiting episodes of vomiting after breastfeeding or eating or whatever. They throw up.
That is GERD. And you find that before. I know most of the viewers also are wondering what is gagging. Gagging, most parents are always scared when they see the baby when you feed them, they're like, but they have not vomited. When you vomit, you're kutoa, like you're removing the vomit. But when you're gagging, it's like, and most parents panic thinking like, oh my God, my baby is choking. Oh my God, that is not choking. That is normal because this is something that is passing through a very tiny place. And that place is, because it's tiny, the baby sometimes can gag. It's so normal for a baby to gag. But when the baby starts to vomit now, all the time you're feeding them, that shows they have GERD, the advanced reflux acid. So these are the signs we've said that is vomiting. So when your baby starts to vomit more often, all the time, consistently, the first time they vomit, you can monitor. If they can do it often and often, that shows that now this is alarming. Okay, you can take them to the doctors first, but you can always try home remedies for the baby. And first of all, you make sure the sitting position of the baby when you're feeding. This way again, because the airway, you're slanting back. So the airway, the esophagus, the food is coming back and down. So mostly if they're just seated like that and you're feeding them, and this is the normal position that they are, definitely they can get this reflux. So make sure the baby is seated upright, on your lap or on a chair where you can feed the baby, okay? And also make sure you're feeding the baby small portions. Small portion, different intervals. Don't feed so much food to the baby, okay? That can easily cause the acid reflux, okay? So that's another point. Another point, when you're breastfeeding the baby, okay, the position in which, don't slant the baby like this, your breast is here. Always, if you don't have a support system, always try lifting your leg up so that the baby is okay. But you can always put a pillow and make sure the baby is not lying like that. At least sitting in that area before you breastfeed, and make sure the baby has hold the nipple very tightly. Sometimes the baby, when they leave or you're trying to squeeze in and then they gasp in so much air, that again can also cause the GERD or the acid reflux.
Okay, Angie, what would you say about constipation? These kids are still small. These are new things being introduced to them. What do you think a parent should do when the baby is constipated, or how do they avoid constipation in general?
Yeah, good question. So most of the parents, if you introduce your baby to early feeding, I say it also can cause constipation. And some of the signs when you know your baby is constipated, you check your baby's stool. You find there are particles, the way a goat can poop, those particles. So you find there are particles which that is not a healthy way a baby should poop. It should be very light consistency in the poop. So that is one of the symptoms that you can tell whether your baby is constipated. Now let's move to the foods that you're feeding the baby. When you start off, make sure you also introduce water to your baby. Most parents don't give baby water. Water is very, very essential, and it shouldn't be cold, guys. Make sure you're warming the water. Okay, that water should be a good temperature on which it can really the baby can easily take it. It shouldn't be cold. So when you're introducing water, again, making sure the baby takes teaspoons. Okay, and don't, after feeding the baby, immediately give water. Even for adults, you shouldn't do the same. After some time, you can give a teaspoon, and then as the baby grows, the mLs also increases from 80 to at least 100 ml when they're going up and they're growing older. So make sure you're giving a teaspoon of water all the time. Then another thing that can cause constipation is lack of putting oil in your food. Oil is very essential in digestion of the baby. Okay, so when you're giving oil to the baby, it's also when you're putting the little bit oil in their food, it's also going to soften their system. You know, the oil's purpose, as much as it regulates temperature, it also soften your gut system and also digestive system to prevent constipation. Then other parents give too much of vegetables to the baby. That can easily cause constipation. It can cause constipation, yes. The baby's system is developing. As much as fiber has good roughage and all that, it helps with preventing constipation for adults, but for the baby, if it's too much, it's going to cause constipation. That fiber is going to be very hard for the baby to digest. Okay, so it should be so little of the vegetables. Your baby's food should be always a lot of carbohydrates and less vegetables and less protein. Yes, it shouldn't be the other way around like adults. Yes, so that's another reason why baby gets constipated. Others, they introduce very tough foods for the baby to digest, like milk. Cow's milk is very hard for the baby to digest. And if you introduce cow's milk to a baby, the baby can easily get constipated. So guys, not all those foods that I've said, also eggs sometimes can give baby constipation. Others get constipated. You monitor your baby. Others, there are certain foods that your baby can constipate from that will not affect another baby. So when you identify that, it will be easier for you to know how to make it. You add water. Another problem most parents do, they add milk to the foods of the baby.
True.
And it's so wrong. It's super wrong. Milk has calcium. Your vegetables have iron. Those two, when they meet, the calcium inhibits the iron absorption in the body, in the food, before even the baby gets. So the baby will not get any iron. And you see, from 6 months, this baby has already gotten the iron that they got from birth is now starting to reduce in the body. So they need this iron from the foods. So if you mix the milk with the food, it's going to inhibit the iron absorption. So never mix milk with food. Always use plain water. It's very good when cooking the baby's food. So those are the foods that can easily cause your baby to be constipated. You should always observe when you're preparing and observe the portions of the foods that I've mentioned. Yeah, so in case you have any questions, I think my friend here has no any other further question.
I've learned so much. I'm hoping all of you people have learned something today.
Yeah, so in case we've left out something, or maybe you're a new parent, you don't know what to introduce to your baby, just comment below, leave the comments below, and then we'll look in those questions and then I'll discuss it in the coming videos. So any new parents, any parents to be, you feel like, there's certain thing that I've not talked about complementary feeding, please feel free to comment below. We'll look into that. And I want to thank my friend. People don't know this, but this is my best friend. We've been together for a very long time, and she's a mom. So in case you have any questions, don't hesitate, and I'll see you guys on my next video. Bye.